Hi everyone, my name is Gloria Enriquez. I name my school Pathways because my program is formed in pathways or groups of curricular elements to ensure that the BSN graduate nurse acquires the tools to practice professional nursing. Our BSN program prepares the undergraduate student for the NCLEX licensure exam, and a BSN degree is awarded at the end of the program. The program is composed of two parts that last 4 years. The first part, the pre-nursing program, is 6 semesters long. The second part, the upper division professional nursing curriculum, is also 6 months long. A full completion of the pre-nursing requirements is needed before the student is accepted into the professional program. Students are allowed to transfer credits from other schools or even to directly apply to the upper division if all the pre-nursing courses have been completed. The school has formed alliances with quality educational institutions to facilitate transfer of college-level courses taken during the junior and senior high school years, as well as courses taken at community colleges. The school has formed alliances with local healthcare entities to facilitate students an ample exposure to a variety of healthcare settings and roles for professional nurses. The school maintains relationships with professional nurses on a multitude of roles to offer the apprenticeship program. Lastly, the school has partnership with organizations and individuals who support nursing education to produce resources for scholarship and scholarly activities. The program is delivered as a hybrid modality. All courses are taught on a step-by-step approach, including a faculty-guided informational instruction, on-site simulation and observational experience, articulation of the learned material, and reflection. The online instruction is used by the faculty to guide students through salient points of concepts and skills. The inside experiences are used to allow the students to articulate concepts and skills learned to promote self-confidence and communication skills. One of the advantages of the program is the curricular integrated apprenticeship program, in which the students get to work and assist professionals, nurses in the community in a setting of their choice. This method of delivery is in accordance with the adult learning theory, which says adults respond to relevancy and practicality in their learning and are influenced by their life experiences. The philosophy of the program is explained in this statement. Students and faculty of the School of Nursing engage in teaching and learning processes that enable students to build upon a strong liberal arts and science foundation to integrate the nursing professional knowledge and skills that lead to the provision of competent, compassionate nursing care and leadership in the healthcare system for the health promotion and prevention of disease for multicultural populations. The curriculum organizing framework used is based on the American Association of College of Nursing Essential Series. This organization gave us 9 essential proficiencies to produce quality and safe education. Especially for pre-professional programs, these were published in 2008. I analyzed the essentials for their relationship to the mission and philosophy statement to form an evidence-informed, context-relevant, and unified curriculum. I also use the quality and safety education for nurses competencies. The ultimate goal of this initiative was to move the professional identity forward, modifying the identity of a respected nurse from one of caring and nurturing to a professional who is both caring and nurturing, while at the same time is knowledgeable about quality improvement and the science of safety. This curriculum design is grouped in 6 areas of mastery to progressively develop professional expertise in nursing. Mastery number 1 refers to communication and collaboration skills. In nursing, that alludes to competencies needed to deliver patient-centered care, communication and collaboration among healthcare professionals, and the ability to manage information, knowledge, and technology to inform practice decisions. This program aims at giving the student an understanding of the elements and barriers of communication, the principles of effective client and family teaching, workplace and organizational communication, and conflict resolution to prepare nurses who can improve patient outcomes by promoting health, therapeutic relationships, and education. Nurse informatics is addressed in this area because BSN prepared nurses are expected to be proficient with technology to provide safe patient care and to apply evidence for practice decisions. Mastery number 2 refers to clinical reasoning as the process and clinical judgment as the outcome. This program aims to develop inquiry and analysis skills to prepare BSN nurses at the level of other professionals in the healthcare team while having abilities to solve and provide patient-centered care. The strong emphasis on liberal arts and humanities education of the program provides the foundation for developing clinical reasoning and clinical judgment. Clinical judgment needed in professional nursing is also dependent on the development of personal values. Professional nurses in the program will develop a value-based behavior to build a practice that is culturally sensitive, compassionate, appreciative of diversity, and patient-centered. Mastery number 3 refers to leadership skills. These skills are built by awareness and understanding of complex healthcare systems and the impact of power, politics, policy, and regulatory guidelines on these systems. Professional nurses must have a solid understanding of the broad context of healthcare, including the organization and financing of patient care services and the impact of regulatory guidelines on practice and reimbursement. Mastery number 4 refers to scholarship for evidence-based practice. It is important that the professional nurse understands how evidence is developed. An essential topic of scholarship is patient-centered care that utilizes technology, research, clinical expertise, and patient values for optimal care. Professional nurses integrate evidence to inform practice, make clinical judgment, and use legal and ethical precepts to safeguard the rights of patients. Also, it is necessary to understand scholarship to efficiently collaborate with other healthcare team members in documenting and interpreting evidence for improving quality of patient outcomes. Mastery number 5 refers to clinical prevention. Clinical prevention refers to individual interventions to prevent escalation of diseases. Nursing a population is the domain of professional nursing that prioritizes primary prevention, reaching out to those who will benefit from a service and activating resources for best overall health outcomes for populations. For this mastery, knowledge of informatics and use of technologies are essential to understand health status of communities and to communicate with other health professionals. Mastery number 6 is about diversity. Having skills in diversity means being able to appreciate human variations such as age, race, gender, disability, ethnicity, nationality, religious and spiritual beliefs, sexual orientation, political beliefs, economic status, native language, and geographical background. The program cultivates knowledge of diverse cultures, promotes communication skills, and cultural appropriate care that reflects sensitivity and appreciation for diversity of others. Diversity skills are utilized in caring for all clients and are critical in the care and consideration of at-risk populations made helpless by circumstances including age, functional or developmental status, ability to communicate effectively, presence of chronic or terminal illness or disability, and personal characteristics. The professional nurse practice in the AACN says the professional nurse practices in a multicultural environment and must possess the skills to provide culturally appropriate care. So the freshman year curriculum is heavily composed by liberal arts and humanities, as you can see here. A large core of courses in the areas of literature, fine arts, general humanities, social science, and history are options available based on personal interest and ability. The sophomore year introduces the same concept of the first freshman year. The upper division program will start in the summer semester and runs through the fall and spring semester the first year. The fourth semester, which will fall in the summer semester, the student will have the opportunity to participate on the apprenticeship program, cultural expedition abroad, learning Spanish for nurses, or immerse on a risk population specialty clinic. This semester course will foster personal relationships for the student in the community and provide unique and relevant experiences based on personal interests. The last semester focuses on leadership and transitioning to professional practice. During this semester, the candidates will prepare for the NCLEX examination. A trusted NCLEX review and practice will be provided for all students as part of the curriculum. Last, the learning outcomes. These are the learning outcomes. Please read them. They are congruent with the rest of the curriculum. Thank you for listening and evaluating my presentation. This concludes the presentation. Thank you.